Good morning, good afternoon, and I will be talking about the perspective of hepatitis B birth dose vaccination in the WHO African region. And this is the outline of my presentation. In 2019, there were about 1.5 million new cases of hepatitis B infection in the world. And among these new infections, 66% were in the Afro region, as shown in the map on the left side, with Africa in red. And globally, we have about 296 million people that are living with chronic hepatitis B infection. And 82 million of those people, of the people living with chronic infection are in the Afro region, so about 28%. So the World Health Organization, the World Health Assembly endorsed the global health sector strategy for viral hepatitis elimination. And this global health sector identify 5 core interventions with targets that will lead to elimination by 2030. And among those 5 interventions, we have 2 interventions related to hepatitis B vaccination. And the first one is the 3 doses of infant vaccination with a target of 90% coverage by 2030. And the hepatitis B birth dose for prevention of mother-to-child transmission with a target of 90% coverage by 2030, and a milestone of 50% coverage by 2020. And the WHO Afro region regional committee endorsed those targets with an additional target of having 25 countries that have introduced the birth dose by 2020. Now, how are we doing with regard to those targets we set in the Afro region? On your left side, the table is presenting the prevalence of the prevalence of hepatitis B among children less than 5 years of age in the world. And as you can see on the table, highlighted in red, Afro has a prevalence of 2.53%, which is the highest in the world, and compared to the global prevalence that is at 0.94%. And on your right side, you can see on the graph the prevalence of hepatitis B among children less than 5 years of age by country. And the red line is showing the target, the global target, while the green line is representing the regional target. And as you can see here, we have 13 countries that have reached the global target of having less than 1% prevalence by 2020, and 25 countries that have reached the Afro target at 2%, less than 2%, less or equal than 2%. And this is why the incidence is still low, because we have a very low coverage of the birth dose in our regions, as shown in this map. And this map that is showing the timely birth dose vaccination coverage in the world. And Afro is highlighted here in red. And the gray color is representing countries that don't have the birth dose or that don't have a universal birth dose. And as you can see here in the Afro region, most of the countries don't have the birth dose. And to zoom further down in the Afro country, this graph is showing you the number of countries and our coverage over time. The number of countries that have introduced the birth dose and the coverage of timely birth dose over time. And as you can see here, by 2020, we had 14 countries that have introduced the birth dose, which is representing by the blue bars. And the coverage, which is representing by the red line. And in 2020, you can see that we are at 66% of coverage. And one thing to note here is the slow uptick of the birth dose vaccination over time. So between 2000 and 2012, we only had 7 countries that have introduced, and we had 7 more countries in the last 7 years. And this is to show you the countries that have introduced the birth dose. And on your left side in the table, you have the countries with the years of introduction. And just to highlight here that 7 countries that have introduced are Gavi-funded countries, while the other half is not Gavi-funded. And to say here that Gavi is an organization that is financing children vaccination across the world, and mostly in Africa. And on your right side, you have the map is showing you the coverage of whole birth dose combined in these countries. And just to mention here that this is including not only timely birth dose within less than 24 hours, plus also doses that are given after 24 hours, because in some countries, the birth dose can be given up to 2 weeks after birth. So what are the challenges? The challenges are really the political will to introduce the birth dose in routine schedule. Because as you have seen, I mentioned earlier, that 7 countries are, only 7 countries that are not Gavi funded have introduced the birth dose, when we have about 37 countries that are Gavi supported countries in our region. And the other 7 countries that have introduced have done that on their own, and they are not Gavi funded. So one of the challenges that is brought up is really the lack of funds for this introduction nationwide. And another challenge we also see in the region is really the lack of insufficient data in the region. Data on the burden of the disease itself, and also data on the burden of the disease that can really help to guide the policies. And another issue, another challenge we have also in the region is the low institutional delivery, with most of the women giving birth at home, which can make really giving the vaccine within 24 hours a big challenge. And as the vaccine has to be given within 24 hours in maternity wards, that's when we have to extend the cold chain capacities to be able to be providing those vaccines even in the healthcare structures. And also we have another challenge with the national immunization technical advisory groups, because now for a new vaccine to be introduced in the country, it has to be recommended by the national, by the NITAG. And in the Afro region, we only 37 countries have established NITAG. And among those that have established NITAG, only 23 have functional NITAGs. So what's the way forward? The way forward for us is to really build a community to support, to advocate and support really the introduction of the birth dose widely in the region. And also is to support the generation of evidence, like studies for like pilot introductions, or studies to really determine the true rate of mother-to-child transmission, and also sero surveys that can help really to find the burden among in the population, and specifically among the children less than 5 years of age. And another way is to really enhance the NITAG capacity to help in the recommendation for the introduction of the vaccine in the country. And lastly, we also have is the implementation of the Gavi 5 strategy. that is supporting the birth dose vaccines in routine schedule. And that will really help in the region where we only have, as I mentioned, 1 in 6 countries that are Gavi supporting that have introduced the birth dose. Thank you for your attention.